Top10MD is a internet-based service where they provide a service to patients and potential patients that are looking for board-certified, legitimate physicians who are ethical, honest, and qualified to do the job. For the doctor, it's basically a differentiating factor in the marketplace. One of the things is it's very difficult to become board-certified. You have to do the proper training, do the proper residency, fellowship if necessary, in order to get the qualifications to do what we do, whether it's plastic surgery, orthopedics, or another specialty. Many physicians struggle with competition in the marketplace where non-qualified, non-board certified doctors will try to market themselves as qualified to do a certain procedure or practice a certain type of medicine. So what Top10MD helps us do is be a liaison between our practice and the patient, doing all the necessary legwork to justify a physician to be qualified to do the operations or the type of practice, so that at the end of the day, the patient, having verified a doctor through Top10MD, can be certain that they're getting a qualified, ethical, and honest doctor. So Top10MD is part of a global, I think, web presence for doctors. I think it's a differentiating factor in so much as only a third of doctors would qualify for Top10MD based on their criteria, which is, in general, board certification, maintenance of certification, ethical behavior, keeping up with all the things that a physician needs to do to be at the top of their game. So they were very personable meeting with me. I didn't have to come to their office. There was not a lot of email back and forth. You know, the Top10MD staff was able to use a lot of the market generation that I had done over the years, incorporate that in a very tactful way with what they were trying to do. It was not hard for me at all. There was not a lot of back and forth emails. They have the expertise to use what you have, and if you don't have anything, they're more than capable of developing a web presence for you. I think that it's different than most websites in so much as, for lack of a better word, a lot of times the sale is the key. So once they have you locked in, whether it's an SEO company or something like that, they're on to the next guy. With Top10MD, I feel like they really want to work with us. It's an ongoing relationship, and it's not a one and done sort of a thing where they'll take your money, you'll stay with them for a year, and then they're on to the next person. So I feel like they work really hard for the physicians that are members. I think it's a different sort of an approach to the internet, and it would be a way for you to get your qualifications out to a patient in a very tactful, powerful way. I think that a lot of internet marketing is, for lack of a better word, not based on quality, but rather pure marketing. So it combines those two things, and I think that's what makes it unique. I think it's hard work. I think that vetting doctors, you know, you have to verify the hospital privileges, verify their relationship with their state medical board. And there's just a lot of legwork, so it takes a lot of time on their part. And what they're doing is doing a lot of that background work that a patient might not know how to get or might not know how to find, and communicating that to the public in a very tactful, educational way. I wouldn't say afraid of the word standards. I think there's a lot of confusion from doctors. When you talk about things like standardization, it brings up opinions, it brings up government regulation, it brings up things that sometimes doctors can control and sometimes things doctors cannot control. As an example, if you have a physician who has a hospital-based practice and you're asking for standardizations as to outcome, he may have poor outcomes because he's taking care of very sick, poor elderly patients, versus a doctor that practices in another hospital with young, privately insured, healthier patients. A lot of those factors are outside the doctor's control, and when you use a word like standardization, sometimes those doctors might be intimidated because they have a practice where they're servicing a certain patient population that is not going to have good outcomes based on things outside the doctor's control. However, standardization is part of everyday life. What it sounds like, it's basically offering advice. As a physician, I can help guide Top10MD to better serve other doctors. Well, I think that they have a plan in place to extend beyond Dallas-Fort Worth into other marketplaces, extending beyond, standard medical fields. So perhaps they might delve into chiropractic, for example, or other state-regulated types of a practice. I think right now they're primarily focused on allopathic medicine in the Dallas-Fort Worth area, but I know in terms of geographic outreach, they plan on expansion. I think growth. So it's exciting to see a company start and watch them grow. I think that being a part of it is exciting for me, the role that I can play in that process. And I believe that at the end of the day, we're doing a good service by promoting doctors who really put in the legwork to become the best doctors they can be and increasing communication with our patients. The internet is for lack of a better word, sort of an information jungle, and it's important for patients to be able to differentiate between clever marketing and the real deal. So what Top10, I believe, helps is as a patient has an internet experience and they're deluged with different marketing, Top10MD is part of a legitimizing process where a patient would go there, and maybe that's not their only stop, but it would be one stop as they look for a doctor where they would feel good that that doctor is legitimate, board certified, has done all the necessary things to do the best job. And I think when you look at taking care of yourself or your family, that's one of the most important things that patients need to do and is often overlooked.